Today we'll be talking about soft drinks. Yes, this is what you call soda. So is there anything really soft about soft drinks? Or is it causing havoc on your health? So today I'll be telling you 10 good reasons why you should quit drinking soft drinks. First one is aging. Did you know that a can of soda contains about 36 grams of sugar? And do you know that drinking one bottle of soft drink a day can age you 4 years faster? So imagine what is going to happen when you drink about 3 to 4 cans a day. Soda contains phosphate and a lot of sugar, and this can speed up the aging process at the cellular level. It also contains some harmful chemical components, coffee, and the sugar in it is really dehydrated, which may have an aging effect on your skin. It can make your skin so dry that it will trigger eczema flare-ups, acne breakouts, wrinkles, and fine lines on your skin. Another reason why you may want to quit drinking soft drinks is when you begin to experience frequent headaches or even migraines. This is because your soft drinks are loaded with caffeine and artificial sweeteners, and this may cause an extra stress for your brain, hence the headaches. A 2017 study in the Clinical Journal of Pain suggests that aspartame, a sweetener in Diet Coke or other sodas, may make headache worse when people susceptible to migraines consume the amount of aspartame found in 5 or more sodas. Another reason why you may want to quit drinking soft drink is when you find out that your teeth is decaying too fast. First of all, a can of soda contains 36 grams of sugar. It's also known for its high acidic content. Now, what happens is that when these soft drinks get into your mouth, the high acidic content begins to erode on the enamel of your teeth, and the microorganisms in your fangs begins to feed off the sugar, which may lead to cavities. Besides that, it may rob you of essential nutrients such as calcium, which may be so bad that you have rotten teeth. And what's even worse is that the enamel cannot be regrown. So most times people are advised to, when drinking the soft drink, they are advised to sip with a straw, or they are advised to drink while eating. Most people think it's normal to use the bathroom because they've gulped down 2 to 3 cans of soft drinks or even more. Well, it's not normal. In fact, the frequent urination is as a result of the too much caffeine in the soft drink. The extra fluid leaving your bladder if you drink too much soft drinks are causing you to dehydrate if you do not supplement with water. And this dehydration may further lead to a slower metabolism, electrolyte imbalances, water retention, and even heart arrhythmia. Another reason why you may want to quit drinking soft drink is when you find out that you have hormonal problems. The soft drinks, they normally come in plastics, and these plastics contain BPA, that is bisphenol A, which is a chemical, an industrial chemical used in hardening of plastics. Now what happens is that this BPA seeps into the beverages in a plastic and contaminates it. But if you feel you're safe because you're drinking from aluminum cans, unfortunately you are not, because this same BPA is used in the lining of the aluminum can. Well, you may not see this lining in your aluminum cans, your soft drink aluminum cans, because it's designed in a way that it is very difficult for the eyes to see. You can only see this plastic lining in your aluminum cans if the aluminum cans are dissolved in sodium hydroxide, which breaks it down and reveals the plastic lining. And according to research, this can cause hormonal problems or reproductive toxicity. It's even worse when these cans or bottles are exposed to heat or sunlight. Another reason to quit drinking soft drink is forgetfulness. Researchers at the University of California, Davis Michael Center, have linked the excessive consumption of sodas containing BVO, brominated vegetable oil. It's an additive that maintains soda's flavor and its appearance to an increased risk of bromism, a condition that wreaks havoc on the central nervous system. And this contributes to memory loss, memory impairment, muscle weakness, fatigue, and mental health issues. Another reason you may want to quit drinking soft drink is that it affects your sleep, especially at night. Yes, soft drinks affect a person's sleep cycle. It affects the quality and the duration of a person's sleep cycle. This is because the caffeine in soft drink is way much than you can imagine. The amount of caffeine found in a can of soft drink or in a bottle of soft drink is equal to the amount of caffeine found in a cup of coffee. A 2015 study published in the Journal of Preventive Medicine showed that children who had trouble getting enough sleep consumed soda more frequently than their better sleeping counterparts. So you see, drinking soft drinks after dinner may not be a healthy choice to me. Another reason you may consider quitting drinking a soft drink is because you're gaining weight rapidly. Yes, a can of soft drink may contain over 150 calories, but then again it contains about 36 grams of sugar, and that is almost 10 teaspoons of sugar. And this is already way above the recommendations for an entire day by the American Heart Diet. Refined sugar in soda is quickly absorbed, causing a spike in your blood sugar level. This sudden surge in blood sugar triggers the production of insulin and can turn that sugar into fat. Eliminating soda from your diet will definitely save you thousands of calories and hundreds of grams of sugar each year. In fact, a 2013 study published in Nutrients, which followed 800 seniors over a course of 9-year period, found that those who drank diet soda gained almost 3 times belly fat than others who did not. You may also want to stop drinking soft drink if you discover a spike in your insulin levels. The fact is this: sugar in soda decreases the sensitivity in your cells to the effects of insulin, which means that your pancreas starts to make more insulin to reduce or remove glucose from your bloodstream, and this makes the insulin in the blood to spike. This condition is known as insulin resistance, and it can be the first step towards type 2 diabetes or heart disease. In fact, a recent study which looks at the sugar consumption and diabetes in 175 countries shows that for every 150 calories of sugar per day, which is about 1 can of soda, the risk of type 2 diabetes increased by 1.1%. Lastly, joint pains. You may have been experiencing some aches and pains that wouldn't just go away or even get worse each time you pop a bottle of soft drink. The American Journal of Clinical Nutrition suggests that women who regularly consume sugar-sweetened soda have an increased risk of rheumatoid arthritis. So what then is the gain in drinking soda?